Hi everyone, this is Sarah Connor. I'm doing my presentation today on substance use problems in healthcare social work practice. Definition of terms. Understanding the terminology is the first important step to understanding substance use. Substance, for instance, is term substance refers to both legal and illegal psychoactive substances that affect the central nervous system when consumed. Next term is intoxication. The term intoxication is described as a reversible state caused by the recent use of substance that typically is characterized by a substance-specific constellation of psychological, behavioral, and cognitive emotional changes. Withdrawal. The term withdrawal describes substance-specific behavioral, psychological, and cognitive emotional changes that result from stopping or reducing substance use, particularly when someone has been using for a significant or long-term period of time. Substance use disorders. The term substance use disorder is referred to by a pattern of problematic substance use and includes a diagnostic or category of substance abuse and substance dependency. Differences between the population. College-age students and adults are referred to as having the highest level of substance use within the United States. Males have a higher rate of overall when looking at of substance use when looking at the use of the majority of substances, though women are close to male rates in a lot of the substance uses within the few of the studies. Substance use has been higher when it comes to women's use. Ethnicity. Across all of the ethnic backgrounds, there are no clear differences between the substance users and the different backgrounds. Challenges associated with substance use in the healthcare setting. Motivation and readiness for change. Many patients that present in a medical field may not be in a place in their addiction that is to be ready to change their behavior. Many feel that seeking treatment for their medical condition is enough rather than addressing the cause of the medical condition. Stigma among health professionals towards patients with substance use disorders. Across the studies, health professionals have been found to have negative attitudes associated with those that have substance use disorders. It is evident that healthcare professionals that are working in medical settings hold these individuals at a lower regard than others with different medical conditions. Addressing challenges of substance use. Community resources to assist with patients with substance use disorders are an important factor in addressing challenges in substance use users. It is necessary to look at the triggers associated with individuals that are dealing with substance use disorders. Being able to identify the patient's triggers, the social worker will be able to specify the exact treatment protocols that will assist the patient in managing their substance use. Some triggers can be associated with family influences, friends that are not supportive, stress including work, family, and personal stress. Availability to medical insurance is another factor that needs to be addressed when working with individuals with substance use disorders. Helping a client with or without medical insurance becomes an issue when working with as a medical social worker. At this time, that's when it becomes difficult to, assist the clients in the best possible way. Medical social work resources and substance use. It is important to have knowledge about the different effects of substance use in medical conditions. medical terminology, differences between medical practitioners and social workers, counseling skills when it comes to the medical condition and substance use, cultural competency when it comes to the different racial, age, gender, and ethnic backgrounds of the patients affected by medical conditions and substance use. Educational resources for patients that have medical conditions and substance uses, and the effects their substance use has on their medical condition. Interventions and skills like motivational interviewing and skills like those, stages of change associated with helping clients deal with their substance use and medical conditions associated with their substance use. Resources for patients. It's important to help patients find transportation to and from medical facilities and clinics to help treat their medical conditions and or substance use. This is when it becomes important to link clients or patients to transportation services. If it's public transportation, getting them resources to, have friends and family to transport them, those kind of things. Education to deal with the diagnosis associated with substance use and the effects that their substance use has on their medical condition. Family and social supports for patients with medical conditions and substance use. Counseling to address the underlying factors associated with their triggers associated with substance use. Referrals to resources that patients will be able to utilize once they leave the medical setting or clinic. This is important when, discharge planning comes along to help the clients find what it is that they need to, continue their services. Assessments and discharge planning to address the issues associated with patients leaving the medical facility or clinic. Social worker needs. Knowledge. The social worker needs to have knowledge and understanding of the conditions related to substance use, including medical conditions that are related to the substance use. They need to have the ability to be able to be open and understanding about the substance use disorder and the medical condition associated. Also, it's important that they use a motivational interviewing and its applications towards helping with substance use and medical conditions. Ability to build rapport with patients to let them feel understood and heard when it comes to their substance use. This is an important one when it comes to working with clients individually and in groups. A lot of them don't feel that they are being heard by the clinician when it comes to their substance use and the triggers that are associated. Also, it's important that social workers are able to advocate for their clients to receive the care and resources that they need to manage their medical conditions as well as their substance use disorder. These are some of my references that I use to find this information. I hope that everybody has a good time and enjoys my presentation. Thank you.